Good evening, folks. For discussion D, tonight we are discussing why self-neglect happens in older adults. Okay, here's a summary of the key points from the article 12 Reasons People Start Neglecting Themselves as They Age. And then the first headline is why self-neglect happens in older adults. Prevalence: about 27% of seniors experience self-neglect, which includes poor hygiene, missed medical appointments, and general disregard for personal well-being. Financial impact: Medicare data shows that preventable health issues from self-neglect cost over $1 billion annually. Emotional and social toll: the effects ripple through families and communities, not just individuals. Urgency of the issue. Epidemic levels. With 10,000 Americans turning 65 every day, the issue is growing rapidly. Complex causes. Self-neglect isn't just laziness. It stems from a mix of psychological, physical, and social factors. What to watch for? The article outlines 12 specific patterns or reasons why older adults begin to neglect themselves, though the full list isn't shown in the preview. These likely include cognitive decline, depression or isolation, loss of purpose or routine, physical limitations, financial stress. Would you like me to dig deeper into the full list of 12 reasons? The article outlines 12 reasons why older adults may begin to neglect themselves, especially as they face physical, emotional, and social challenges. Here's a breakdown of the key factors contributing to self-neglect in aging individuals. Cognitive decline. Memory issues or early dementia can lead to missed medications or poor hygiene and forgotten appointments. Depression. Feelings of hopelessness or sadness can sap motivation to care for oneself. Okay. Three, isolation, lack of social interaction may reduce accountability and emotional support. Financial strain, limited income can make it hard to afford basic needs like food, healthcare, or grooming. Chronic illness, managing multiple health conditions can be overwhelming and exhausting. Physical limitations, mobility issues, or pain may prevent regular self-care routines. Loss of purpose, retirement, or death of a loved one can lead to a sense of a sense of purposelessness. Medication side effects. Some prescriptions may cause fatigue, confusion, or other symptoms that hinder self care. Environmental neglect. A cluttered or unsafe home environment can reflect uh, and reinforce personal neglect. 10. Lack of access to care. Transportation issues or limited healthcare availability can prevent regular checkups and treatments. Resistance to help. Pride or fear of losing independence may cause seniors to reject assistance. Mental health stigma. That's 12, guys. Give me 1 second and we'll dive into that. Older generations may be less likely to seek help for psychological struggles due to cultural norms. These factors often overlap, creating a complex web that makes intervention challenging. If you're concerned about someone, early support and compassionate outreach can make a big difference. Would you like tips on how to support someone who may be experiencing this? Preventing self neglect in older adults requires a compassionate, multifaceted approach that addresses physical, emotional, and social needs. Here are some effective strategies drawn from expert sources. Okay, mental and emotional support, regular mental health checkups, screen for depression, anxiety, and cognitive decline, counseling or therapy, or counseling and therapy, offer access to licensed therapists or support groups, combat isolation, encourage social interaction through community centers or clubs or faith groups, environmental and lifestyle adjustments, home safety assessments, ensure living spaces are clean, hazard free, and accessible. Daily routine support. Help establish consistent routines for hygiene, meals, and medications. Assistive devices. Use mobility aids, medication reminders, or smart home tech to support independence, medical and professional interventions, primary care coordination, maintain regular doctor visits and follow-ups, adult protective services. In serious cases, professionals can intervene to ensure safety and well-being. In home care, hire caregivers or nurses for daily assistance if needed. Family and community involvement, check-ins, family members or neighbors should regularly visit or call. Education, teach loved ones to recognize signs of self-neglect like poor hygiene or missed medications. Respect autonomy, balance support with respect for the individual's independence and dignity. Empowerment and engagement, purposeful activities, engage hobbies, encourage hobbies, volunteering, or part-time work to foster a sense of purpose. Nutrition and wellness programs provide access to healthy meals, fitness classes, or wellness checks. Preferences. If you're supporting someone at risk, even small gestures like a weekly lunch or helping organize their space can make a big difference. Would you like a checklist or guide to help implement these strategies? Spotting self-neglect early can make a huge difference in someone's quality of life. Here are the most common signs to watch for in older adults: personal hygiene and appearance, poor grooming, messy hair, untrimmed nails, body odor, wearing appropriate clothing for the weather. Noticeable decline in cleanliness or neatness, living conditions, dirty or cluttered home, rotten food, bad smells, or infestations, e.g., insects, rodents, non-functioning utilities, or unsafe conditions, hoarding behavior, or accumulation of trash. Nutrition and health, unexplained weight loss, or signs of malnutrition, dehydration, or poor diet. Guys, this happens in the US. This happens everywhere in the US. People get neglected all the time when it comes to seniors. So that is why tonight I chose to do this show. I hope it helps somebody recognize the signs and be able to help somebody they see, maybe in the public, in their communities. People need, elderly people need assistance, whether seen or not seen. If you hang out with somebody and you realize that they're going downhill in the wrong way, support them if you can. If you have their trust, support them. That means a lot to them. And if they have mental decline, that's even worse because they hide it very well. People hide it very well if they have mental issues on top of elder neglect. So hope this helps somebody. For now, Gator Wellness, take care, folks.